Welcome to the infection course. This course will be focusing on the infection component of the GPHC exam. Now let's run through the basics of infection. First of all, we do not treat viral infections with antibiotics. We only treat infections caused by bacteria, which is common sense really. Now, when we are treating an infection, the most important thing is to take samples. These samples are useful for microbiology culture and sensitivity testing, and they indicate which bacteria is causing the infection. As a general rule of thumb, we prefer narrow spectrum antibiotics as opposed to broad spectrum antibiotics. And the reason for this is narrow spectrum antibiotics will focus on the bacteria that's causing the infection, and broad spectrum antibiotics increase the likelihood of super infections. Now, what does dose depend on? It depends on age, the weight, the hepatic function, which is the liver function of the patient, the renal function, which is the kidney function of the patient, and the severity of the infection. Now, the route of administration will depend generally on the severity of that infection. And of course, generally we'll give IV for life-threatening infections because they have a higher bioavailability. Now, the other thing that's pretty important is the duration of treatment, which depends on the severity of the infection. If we unnecessarily exceed the duration of treatment, we increase resistance and we also increase cost.